Hello, my name is Ariana Anjez. I'm the Senior Director of Afghan Health Initiative. I obtained my public health training at the University of Washington, and I co-founded Afghan Health Initiative in direct response to the disparities and adverse health outcomes that I've been noticing in the Afghan immigrant and refugee community. Since then, Afghan Health Initiative has been at the forefront of responding to the COVID-19 pandemic in my community, from working with the local health department to working with the Washington State Department of Health and local medical providers. We have been working on COVID-19 testing, in language 19 information outreach, providing hygiene supplies and direct aid to the community who have been suffering from economic disparities as a direct result of the pandemic. Most importantly, Afghan Health Initiative has become a bridge between systems and our community to center immigrant and refugee voices during the rollout of the vaccine. COVID-19 vaccines have been developed and many people are receiving vaccines around the world. Vaccines will be crucial to help us end this pandemic. Many people from the immigrant and refugee community, myself included, have questions about the vaccines. We want to know if they're safe, how they work, and who can get the vaccine. Today, I'm joined by Dr. Shoshana Alenikoff and Dr. Liza Perpuse from Health Point to help answer these questions. And I will go ahead and defer to the doctors to introduce themselves. Let's start with Dr. Liza Perpuse.
Good morning. I'm Liza Perpuse, and I'm the medical director at Health Point in SeaTac, where I'm also the clinical director. Within the organization, I also work as the specialty director for refugee and immigrant health. I've been at Health Point for 15 years, and what sustained me and given me so much joy is the ability to partner with our community partners to help our refugee and immigrant patients, as well as the direct care that I get to witness with my patients.
Hi, I'm Dr. Shoshana Alenikoff, and I am the medical director at Health Point, the Midway location. I've been with Health Point for just over 5 years, and I am a family physician, and I provide care to everyone in the family, including pregnant women. I get to deliver babies and take care of families, and it has been my great joy and honor to take care and get to know many families in our community, including many refugee and immigrant families over my time.
Thank you both for joining me and to talk about COVID-19 vaccines today. I'd like to start with a few questions. So first off, just to start us off, I want to know if you both have received the vaccine, maybe some reasons around why you got it, and what did you experience?
Sure. So I am very lucky to have received not just one, but 2 doses of the COVID-19 vaccine. I was really excited when I found out that we would be able to get vaccinated as healthcare workers in this state. And I really got vaccinated to protect myself, my family, and my community. My husband is also a healthcare worker, and we have a young child at home. And we have both been taking care of patients, some with COVID, over the last many months. And thoughts crossed my mind, like, who would take care of my child if we both got sick? Or worse, would we end up getting our young daughter sick because of exposures that we had had? And so for me personally, I just felt a great sigh of relief once this vaccine was available and I was able to get both doses. And on top of that, I have just seen so many of my patients and their family members get sick or lose loved ones. In fact, earlier this year, one of my own family members became quite sick from COVID, and we couldn't travel to see her, of course. I want this to be over. I want to go back to how our lives were, where we didn't see so much suffering in our communities and in our families from this disease. And I really believe that vaccines are the way to end this pandemic. And a little bit about my experience. I was very, very excited to receive the vaccine. I did have a little bit of soreness in my arm after getting the vaccine, both the first and the second dose, which was really similar to other vaccines that I've had in the past. I also felt a bit tired for the first day, but I was able to continue to work, to continue to care for my family. And so I was pretty lucky that I didn't have any significant effects. And the small effects I did have reassured me that the vaccine was doing its job, which was providing immunity to my body.
Great, thank you for sharing. Do you mind elaborating a little bit more about some of the symptoms that, not symptoms, but the reactions that people get from the vaccine? There's a lot of information going out, on social media and things that community is hearing, like the zombie apocalypse is going to happen, and things of that nature.
Sure, yeah. I'd been hearing that too, and I actually wore my Band-Aid, even though I really didn't need it because there was no bleeding or anything, but I wore my Band-Aid for many days so that I could, in the clinic, show people, like, I seem fine today to you, right? And they would say yes. And I said, well, look, I just got my COVID vaccine and I'm still here. I'm your normal doctor. So certainly side effects are possible and exist with many vaccines. And most of the time are quite minor. And again, like I said, just show that the vaccine is working and helping your immune system to respond. The most common side effects that we know about are having a sore arm, like I mentioned, I had that. Some people experience headache, fatigue, which is something that I also experience, feeling tired. Some people just find that they feel sort of achy or sort of fevery. Those are all pretty normal. We are recommending people hydrate really well before their vaccine, make sure that they are eating enough to come to their vaccine feeling in their best health in order to get that vaccine. And of course, there are people very rarely, as is true for all vaccines, who have a more serious side effect, and that's very rare, and certainly would recommend that anyone who has experienced side effects reports that to a medical professional. But most people do quite well.
Thank you. Dr. Lucas, we'd love to hear from you as well.
Yes, so I feel really lucky to have received my first vaccine. I'm due for my second one next week. My husband's also in healthcare, and he's received actually the Pfizer vaccine, and I received the Moderna. So we joke that we get to compare each other's experiences. We have been living through the pandemic. I still remember, the first day starting to get phone calls on February 29th last year, and realizing that would end our lives were going to change come Monday. We haven't been able to see my mom. She is 84 years old and has diabetes. We've seen her, out the window, or, maybe she'll come and visit and, during the summer was watering the plants in our garden, but my children have not been able to hold her, have not been able to snuggle up on the couch and read with her. And we're really looking forward to getting this vaccine for her. And we're really happy that we got it for ourselves so that we can be a family again. We really miss that. I have school-aged children who, like many families, are staying at home, and that's been really stressful as parents, working our daytime jobs and also having to be teachers, which I'm not trained to be. My daughter's older. She's a freshman in high school. She should be with friends. She should be learning in school. And until the numbers in our area get better, they're not going to be able to do that. So, and again, I wanted to protect our staff and our patients, and make sure that, we can get back to the lives and get back to the people that we love, because this has been really hard on everyone. I tend to react a little bit stronger to vaccines, and I know that every year when I get my flu shot, and I just make sure that I get my flu shot on a Friday so that I can rest on Saturday. And I like to think it's because my immune system is nice and strong. It's recognizing that viral particle, at least for the flu vaccine, and making a really robust response to protect me. And so the same thing happened with the coronavirus vaccine. I got it in my arm late at night. The next morning, woke up with a headache, felt tired that whole day, and then had some arm soreness that lasted for about 2 days. And, I suspect that I'm going to feel tired after my second shot. So again, I scheduled it a day before. I know that I don't have to work and rest, and just going to take care of myself that day, and my family's going to allow me to take care of myself because they want me to be protected as well.
Thank you for sharing. You mentioned a little bit about the immune response, how your body would recognize that particle in the vaccine. Mm-hmm. Do you want to tell me a little bit more about how these vaccines work?
Sure. So these vaccines are a little different than the vaccines that we've had in the past. Specifically, it is a bubble that's made out of fat that protects this very, very fragile messenger note called mRNA. And basically, we're injecting that into your body, and your body uses machinery that it already has to read that note, that mRNA note, and make a protein that the virus makes so that our body can make a response of it. And that note gets eaten up really quickly in our body. And you might have heard that, the vaccine has to be refrigerated and it has to be handled very carefully. And it's because that message, that mRNA message, is so fragile that we have to be careful with it so that it's intact when we put it in. It lasts very briefly in our body, but then produces that protein in our body that our immune system then makes, recognizes, so that if we ever come across the real thing, our body is ready to go. One of the examples that I talked to one of my kids about was, if I told you to go into a forest and to draw me a picture of a snuffleupagus, but you didn't know what that looked like, how many snuffleupagus pictures do you think you're going to send me? But if I show you a picture of the animal that I actually want you to draw me, then you're going to be able to find it more easily. And that's what the vaccine does for our bodies, is it draws a picture for our body so that we would be able to recognize COVID more easily.
Thank you for explaining that. I'm sure you've heard, or at least I have heard, a lot of community members are talking about that if you get the vaccine, you're being microchipped by the government or your DNA is going to be altered. Is that true?
No. And I understand, this is new technology, but the vaccine has basically 4 ingredients. So again, it has that bubble, which is made out of fat. It has that really fragile message inside. And then it has some salts and sugars in it to make sure, again, to keep that fragile message and the bubble intact. There's no microchips, and there's no other things in it because, again, we really need to protect that message. And it really is a technology developed to help protect us and end this pandemic.
Oh, what a relief. Okay.
So, sort of tag on to what Dr. Purpose is saying and just say that I've had patients ask me, can I get COVID from the vaccine itself? And just like Dr. Purpose mentioned, the vaccine really helps your body be prepared in the case that you would be exposed to COVID in the future, but the vaccine itself does not give you COVID. So what's being injected into your body is not the coronavirus. And similarly, this process that Lisa just explained also means that even though you're giving a message to the body, you're not actually altering the DNA or altering any part of the cells of your body. This is just a message that your body knows how to read. And so I certainly know people who have asked that question, and it's a great question because some people do, have a headache, for example, after getting the vaccine, which is also a symptom of coronavirus, but that headache is not your body getting coronavirus. It's your body mounting an immune response.
Oh, thank you for that explanation. I did not know that. And I'm sure a lot of people listening to this and tuning in will be appreciative of that answer. So how exactly does it work? I've heard that you need 2 doses of the vaccine. Is that true?
That's exactly right. All of the studies so far have looked at the Moderna and the Pfizer vaccine, which are the 2 vaccines that we're currently distributing in the US. And both of those have been studied, showing that the maximum efficacy, meaning that it's best at preventing coronavirus infection and illness if you get 2 doses. And each vaccine has their own specifications for exactly how many days or roughly how many days after the first dose you should get a second dose, but it is strongly recommended to get that second dose. And if you think about that, that's really similar to a lot of other vaccines that some of us might have had as kids, where, or even we see our kids getting immunized, where they get the first dose and then they're told, or we were told, come back in a certain number of days or months so that we can give you the second dose. So that's a really common strategy that's used for vaccines. And the 2 vaccines that are out right now, the Moderna and the Pfizer vaccine, have different lengths of time to that second dose, but typically it's between about 21 and 28 days later. And, I've been asked also, do you know if we're ever going to have to get this vaccine again, right? Like, is this the kind of vaccine like the flu vaccine that we get every year? Or is this the kind of vaccine like a tetanus vaccine that you get every 10 years? And the answer is that we're not quite sure yet. It hasn't been around long enough to know exactly how long the immunity will last. We do think, based on the studies so far, that it will last at least a year, if not longer. But it's possible that it will become something like the flu vaccine, or even incorporated into the flu vaccine in the future, potentially, as something that we get every year to help protect us and to help make sure that we don't have a global pandemic ever again.
That's great to know. And I think that kind of answered my follow-up question. I was going to ask if, we receive that vaccine, are we fully immune to COVID? Can I stop wearing a mask, and can I stop social distancing after I receive that vaccine?
Yeah, no, we still need to continue wearing a mask and social distancing even after the vaccine. The vaccine is just one tool that we have to fight the pandemic, and it's a great tool that we're really excited about. But we're going to have to take some time also to learn, if the vaccines continue to prevent people from infecting others with coronavirus, not everyone, we have a shortage of the vaccine, or not enough vaccine for all the people who want it. And so until we can get a significant number of people vaccinated, we're not going to reach those levels where we can start seeing the amount of virus in the community go away. It does take some time for your immune system to develop the ability to recognize the coronavirus. There is maybe a little bit of protection after the first dose, but the studies were really done, the studies that showed how effective it was were really done in people who had received 2 full doses. So we don't really know the efficacy of the vaccine after just 1 dose. And even though this has been a really great vaccine, it's only 95% effective. So, there is still, it's not perfect. So we still need to do everything that we can, washing our hands, wearing our masks, socially distancing, until we see the numbers going down to a safe level in the community.
Thank you.
And I think a question that comes up a lot is, if this vaccine is not 100% effective, although let me say this vaccine is super effective. It's one of the most effective vaccines that we've ever created. And, if I'm going to continue to have to mask and social distance, like, why bother getting it? And I think the answer to that is, if enough people get this vaccine, we will end this pandemic. And at that time, we won't have to wear masks anymore. We won't have to avoid seeing our vulnerable family members. We can go back to that life that we were used to. And so it might not happen immediately. It might not be you get your dose and you walk out of that clinic and all of a sudden you're back to your normal life. But that's something that we can get to if we all do our part to get vaccinated. So that incentive is certainly there, even though it might not be felt immediately.
The vaccines are pretty new, and they were developed very quickly. Probably the quickest vaccine that I have ever seen be developed. How do we know that they're safe and it's not just rushed?
That's a great question. The coronavirus vaccine was developed quickly, but it was tested on just as many, if not more people than any other vaccine would have been. And the reason is that there was a lot of funding towards the development of this vaccine. And because the rates of coronavirus, unfortunately, are so high, there was a lot of availability for testing how well and how safe this vaccine is. So every vaccine, in order to get approved to be distributed or manufactured, has to go through a really rigorous process of investigation, of scientific study, and then there's a number of different independent organizations that look at the vaccine and look at all of the data from those trials and determine whether or not it's safe. And every single one of those groups that have looked both on the state level, the national level, and even internationally, that have looked at the data from these vaccines have determined that they are both safe. On top of the really 30,000 people that were, even more than 30,000 people that were in both of the two big trials, on top of that now, hundreds of thousands, in fact, millions of people have received this vaccine to date in our country alone. And we have been very closely monitoring for any side effects or anything that would make us think that this vaccine is dangerous. And we just haven't found them. Even in the millions of people who have received this vaccine in the last month, many of us have signed up for a system to track our side effects and report them directly to the CDC. Very, very, very few serious side effects have been reported across a large swath of the population that has been vaccinated. So I'm feeling really confident in the studies that were done initially, in the governing organizations that looked at those studies, and then in what we know from starting mass vaccination.
Great. And so what are some of those more adverse side effects? And if I experience them, what should I do?
Probably the one that people hear about in the news a lot is the anaphylaxis, which is that really severe allergic reaction that people have. And keep in mind, this is very, very, very rare. It's a risk with other vaccines as well, and it's something that we're monitoring. So basically, your body has such a severe allergic reaction that your blood pressure drops. But all the places where the vaccine is administered have medications to give on site to reverse that reaction and get you to a safe place where they can take care of you. So, it is a rare reaction. It's something that we're aware about and fully prepared to handle if needed. And so that's the one that's been most noted in the news. And then some of the side effects are the things that we talked about already, which are really just a sign of your immune system doing a really good job of fighting, of mounting a response to the virus. So again, your arm might be sore, headache, feeling tired, maybe some body muscle aches and joint aches, and even a slight fever or chills are all normal symptoms. Making sure that you're well hydrated, eating a light meal before and after the vaccine, moving the arm, even if it's sore, and lots of rest can help you get better. Sometimes people can have kind of a local reaction in the area, and so it is normal for it to be painful. You might notice a little bit of swelling, but if you notice redness that's growing or any, discharge or drain, like fluid coming out of that area, then that's when you would want to call your doctor, because that wouldn't be a normal response. But it is normal for it to feel sore for a couple days, and moving it can be really, really helpful.
Thank you. I also wanted to know specifically about breastfeeding and lactating mothers. And does that immunity pass on to the newborn child or the child who's breastfeeding?
That's a great question. This is of particular clinical interest of mine because I'm a doctor who takes care of mothers and babies, pregnant women. And it's of personal interest because I am a breastfeeding mother. And I really looked into the data and into the recommendations of the medical organizations I most trust to make a personal decision about what I was going to do. And the big studies that have been done so far did not include pregnant women or breastfeeding women. But what we know about all other vaccines is that most of our vaccines are completely safe, particularly these mRNA vaccines, safe and recommended in pregnancy and also in breastfeeding women, particularly women who might be at very high risk, like healthcare workers, for contracting coronavirus. It's thought that the risk of that individual being sick from coronavirus is probably higher than the risk of getting the vaccine. So looking to the organizations I trust and thinking about the evidence myself, I made the personal decision to get vaccinated. And I think that for anyone in this situation, this is a great topic to talk to your provider about and to make an educated decision for yourself about. In answer to your question, does it provide immunity to my kid? You know, I think that's a great question, and that's a really hot topic of research. We don't really have an answer yet, but I'm certainly hopeful that I'm providing some protection to my kid as I'm breastfeeding them after having gotten my own vaccines. But I think the evidence is still to come to fully prove that.
Thank you. I also want to know, where and when can I get a COVID vaccine in Washington?
That's a really good question. And it's, you know, the biggest thing that's complicating everything is just we don't know our supply. So, you know, the state of Washington gets their supply of vaccine, and then that gets distributed. And that happens on a weekly basis. And, you know, we don't know what the supply coming out from to Washington's going to look like from week to week. So you might be seeing that some clinics are doing walk-in appointments, that you can also get appointments at some of the larger institutions like the University of Washington and Swedish and CHI Franciscan. First of all, the important step is to figure out if you and your family members are eligible for the vaccine. And we're trying to ramp up our ability at HealthPoint to help our patients figure some of that out, because there are tools. There's the Face Finder tool, which we can share, but they can be a little bit difficult to navigate sometimes. And so we are trying to ramp up a way to help people get through that online survey. And once you get through that online survey, it'll then tell you different places where you can vaccinate. You know, we are ramping up our ability to vaccinate in our own clinics, and hopefully by the time that this video comes out, we've already started. But we will definitely be calling our patients, sending emails, sending messages through a portal about when they're eligible to get the vaccine. Although I know people are really curious to see where they fall. So there's those online resources as well. So definitely, you know, at least if you're a HealthPoint patient, I've been seeing this happening with other doctors' offices as well, keep an eye on your email and also your mail for information about when you can get the vaccine. You know, and I think some of the frustrating things, you know, I had to help my own mom schedule her appointment, and I made it this week, which is January, and I wasn't able to get her an appointment until March. And it's really frustrating that it's so far out, but it was also just a huge relief to have a day and a time where she can finally get vaccinated. You know, it's quickly changing and things are starting up. There's supposed to be some large clinics in South King County. But again, it's keep an eye out on the news, talk to people, call us for more information as time goes on.
Thank you.
I know that because this is changing so quickly, I think that one of the tools that I've used to help keep up to date with who can get vaccinated, where, when, has been social media, to be totally honest with you. I think that, you know, there's some really trusted resources, the Washington Department of Health, King County Public Health, HealthPoint, the Afghan Health Initiative. You know, these are trusted organizations that are seeking out this information and trying to get the most up-to-date information out to everybody. So if you have a favorite way that you get media, make sure that you're following, you know, certain groups that you really trust to get the information that you need, or in a language that feels comfortable for you. And I think that those organizations and groups are doing a great job of putting information out as soon as it's available.
Thank you. So just to summarize, what I'm hearing is just because it's my turn doesn't mean it's necessarily right at that moment, my time to get the vaccine. So I should be patient. Great.
And that's hard because probably people have been waiting for a year now. Right? We've been waiting for things to get back to normal. And it's hard to just say, well, just be patient a little while longer. And I recognize that. I do think that vaccination is going to get faster and more widespread, and we're going to have to be a little less patient. But for now, I would say be hopeful and be patient.
Right. And I think that's a lot in part because of how, anticipated this vaccine was for so long. And we're all in such a hurry and such a, understandably want to get back to our normal ways and get back to the life we once knew.
Right. And on the other side of that coin is if you get a chance to be vaccinated, take it. Because, again, since this is such a moving target, or it's just changing all the time, you don't always know when your next chance is going to be. So, and if you need help with that decision, then, definitely reach out to your primary care provider office, reach out to us and your organization to help answer some of those questions.
Great, thank you. And I think our last question, and something that is really important for all of us in the community as a BIPOC immigrant refugee community, we've experienced a lot of historical trauma, a lot of mistrust in the systems. And so, with many of us being essential workers and many of us being one of the first groups to have to get the vaccine or being offered the opportunity to get the vaccine, how do we know we're not being a testing ground for the vaccine for people who are, having to wait?
That's a really good question. This is a really new technology. I think over the year, this past year, we've seen how COVID has affected our refugee and immigrant populations disproportionately compared to white populations. And so it makes sense that, our communities should be first in line, but I can totally understand that with it being a new vaccine and also just the sense of it's been a difficult time here in this country. And if, what I hear also is that people are feeling like, there hasn't been this much outreach to us before and this much care for us before. Why now? And so, I think we as healthcare providers need to recognize, and just as communities, to recognize this is a pandemic that is really showing all of us how our lives are really intertwined, that even people that don't speak to each other on a daily basis or have different cultural practices or different religions, at the end of the day, our lives are intertwined with each other. And how can we as communities come to help each other? And I can understand that for some of these communities, it's a really hard ask. And so we just need to continue to hear from our patients, from the Afghan Health Initiative, from other community groups, and from the community themselves about, what do we need to do to make things better and to gain that trust back, because there has been damage, and I think we need to recognize that.
Well, thank you so much for answering that. And I think that, everything that you mentioned, it's really important to understand and to be sensitive of that. And I'm hoping that, with time and with education and with hearing and being, opening those lines of communication between systems and the community, we'll be able to come to a better understanding of that. Well, thank you both so much for, taking the time to speak with me and to answering all of our burning questions about COVID-19. And just a quick shout out to everybody who's watching this video at home. Please follow Afghan Health Initiative and HealthPoint on social media. Visit our websites for updates on the vaccines and what our organizations are doing in the community. And share the video.